Friends, if you've ever dealt with knee pain, you know it can be a huge challenge. It can restrict your movement. It can change your routines up. It can prevent you from doing the things you love. And a lot of times it doesn't seem like there's a lot of options. Today, we are going to tell you some really cool, interesting, and different ways that you can go about dealing with that and treating that knee pain. And of course, I have the one and only Dr. Angela Yeagley in the house today as well.
Hello, everyone.
Welcome, welcome. It is time to elevate and thrive. And as I said, today is all about the knee and specifically dealing with knee pain. Now, this might be an injury. This might be a chronic affliction like an arthritis type situation. This could be maybe you had an injury when you were younger, like myself, a couple MCL tears, a couple of ACL reconstructions from skiing. And now you find yourself, for whatever reason, you're dealing with knee pain. So let's explore where you start.
Exactly. So first, of course, if this is an acute issue, all of a sudden you're doing something, you bend over to pick up a box and your knee gets tweaked and you're like, okay, I went from no knee pain to now it's really hurting. There's probably, some little tiny acute tear, some inflammation in the knee, so that's going to be completely separate, right? Versus, yes, you injured your knee long ago, maybe went from just tweaking and being uncomfortable and now it's getting worse, or, it's a slow development of pain over time. So either way, whether you're dealing with that acute situation, it just happened, or now this has been a chronic progressive issue over time, but you just haven't dealt with it. So first thing is, one, you got to come in and see us, or you need to come in to say you're what I would prefer, your holistic chiropractor, or if you've already established for another reason with your orthopedic doc, then you need to jump in and see them, because really what we want to do is identify, what's going on.
You have to start with understanding what is the issue.
Exactly.
Sometimes it's complex. There are times where you think maybe it is a tear, or maybe you have like some little particles hanging around in the knee causing friction or issues. And it could be completely different than that. It might 100% be a muscle, tendon, ligament type thing where stuff isn't quite aligned and actually has no tear at all. Other times, totally be a tear or bone spurs or some other thing where you really need imaging to understand what the issue is. So definitely, I think going to a holistic chiropractor or a sports doctor like head to toe and seeing the team there is a really smart move, because it's just, you don't have to go through the whole thing of imaging and all that. That's maybe unnecessary, or you have to get approval. It can be expensive and long. I would start with going to see somebody like head to toe.
Yeah, they are fantastic. And for our people that are like, we're their primary care, we absolutely can do the standard like orthopedic testing, and then go, okay, let me tell you at the level that I think it's at and whether or not I think you require imaging, and then or not, and then move forward. So if it's like, how you're presenting, I don't think we need to rush into an MRI at this time, then I will send you to head to toe. Or again, another sports medicine doctor, right? And so it all just depends on, again, your history, your level of pain, how your joint is presenting, which direction you go. So then let's say you are, you've been diagnosed. You're not, I would say you're not going for surgery. Well, we can talk about that, but that would be a later thing. This isn't a surgical issue, right?
Yeah, so we're not going to do a knee replacement, and they don't need to go in there and say do like an orthoscopic repair.
Exactly, right. So you're left to work on the healing of this joint.
You have pain, and it's a non-surgical, you have to look at non-surgical solutions, or you're too young, say, for a knee replacement.
Right.
Because sometimes it's like, well, you kind of need a partial knee replacement. It's the only way we can solve this. And you're like, wait a minute, I'm like 40-something.
Yeah.
50-something.
Yeah, they're like, hold off. The surgeons are telling you, like, hey, I don't even want to do this.
Yeah, you need to be like in your 70s or something before I want to do
Yeah, so hold on, whenever this is like a 40% tear, let's work on, healing this as much as possible. So okay, so you've got your diagnosis. And so first, really, most times, most people are going to need some physical rehab. So whether that's with physical therapy or, again, with our sports medicine docs, right, where you're doing very similar, physical therapy type exercises, you're working on strengthening
and maybe repatterning, and maybe dealing with some chronic, say, inflammation or some sticky points or some trigger points or some muscle imbalance. There can be a whole host of things that can be working against you to end up presenting as knee pain that actually might be connected to a lot of different parts of your body. Might be connected to some ankle immobility or some ankle issues, might be connected to some hip
Yeah,
issues,
hip immobility.
IT band, a quadriceps. Your hamstrings aren't firing properly. One of your left glutes a little sleepy and it's not coming all the way on. All this weird stuff that you don't even think about. It's like, what do you mean my muscles aren't firing or they're like not coming all the way on? Yes, that happens. So all of these different interconnected things could be at play with your knee pain. So to your point, part of it is repatterning, strengthening, getting those issues worked out.
Absolutely. And I think, as we were talking about before we started the podcast, that, I had a very similar experience and a little bit of, chronic knee pain from an old ski injury that was helped by the injections that we'll talk about, an ozone or oxygen injection. It was amazing. And then it started creeping back and I was ready to do the next steps, the interventions that we do that I think are amazing. And again, we'll talk about. But once I started strength training, just within 2 months, it was completely gone and it stayed gone. So obviously it was, probably a combination of that needing to strengthen the muscles around my knee to stabilize it, as well as, probably repatterning because of the additional stretching and movement that I've been doing as well. So yeah, just an example of that, right? So now moving on, you've got the PT dialed in, or you're working with, sports doctor head to toe. You're doing all those things.
You started to increase your movement. Yeah, you're doing some repatterning. Yeah. You're doing some releases. You're getting some work done to help facilitate that. What's next?
Right? So we're working together. We want to optimize your nutrients. So we start thinking about like, well, okay, what are the vitamins and minerals and supplements and things that actually your body can use to actually push that healing, right? We want to speed up the healing. Everybody wants to speed up their healing, right? Nobody wants for it to take as long. Like, just let it take as long as it needs to take. I don't care if my knee is still hurting, right? No, we want to make it go fast, right? So the things that your body's going to need is going to be collagen. That's going to be one. We're going to be looking at, we called them proteoaminoglycans, which is a great word for things like glucosamine, chondroitin, hyaluronic acid, and MSM. So those take a while. They're huge molecules. So like collagen, they take a while to absorb. So once you start something like a glucosamine MSM, it's going to take like 6 weeks before you start really noticing it. So just keep that in mind. A lot of people will give up. They'll do a bottle or a month's worth and go, you know what, this stuff just doesn't work, right? Like I'm done with it. No, in the research, it's 6 to 8 weeks. Now, most people will get something out of it sooner, within a couple weeks. They'll like, oh, yeah, it's a little comfier. I feel a little more fluid in my joint, but just keep going. And so the body will take those molecules and actually go in there and start working on repairing the tissue and regenerating cartilage. So that's pretty cool. So we want you on those. When you have an injury, your need for vitamin C goes through the roof. And so what you should do is you should do a challenge and go up to bowel tolerance. So what that means is every 15 minutes, you do a couple thousand milligrams of vitamin C until you have a very urgent bowel movement. So do this at home. Like, don't go out. Don't go out and about while you're doing your vitamin C challenge, right? Stay home, because that's what you're looking for. You're looking for that flush. And I'll tell you, for most people with injury, they can get up to about 15,000 before they actually have that flush. So that means that your body's using all of that C, right? So then you go to, after you figure out what that is, and you go to 75% of whatever that is. So, if it's 15, then every day you're taking 10,000 in divided doses. So then, any anti-inflammatory herbs can be amazing. So that could be like turmeric. We could also look at bromelain. We can look at frankincense, which is boswellia. So all of those in combination can be incredible. So just to get that inflammation down in the space. And sometimes we'll use what are called proteolytic enzymes, and you take them away from food. And when you do that, it actually helps to remodel the tissue in the space. So it's pretty cool. So instead of laying down kind of like haphazard scar tissue, if something's being repaired, it will lie it down more in alignment, which is stronger, actually. So love the proteolytic enzymes. So we want to do those too. So once we have that dialed in, if you want to go a little further, sometimes we'll reach for some of our injectables. So those would be like ozone therapy, and that's a type of oxygen therapy that we can take and we can inject it directly into the joint, and it's pain relieving. and actually stimulates repair of the tissue, all the tissue that's in your knee. So if you've torn a ligament, if you've torn a meniscus, if you have got some of that cartilage that's been torn, it will work on repairing that. We probably at least want to do 3 of those. And then if it's a little more serious, that's when we start thinking about PRP, like platelet-rich plasma.
What about, and I want to talk a little bit more about ozone, but before we get into ozone and then into PRP, what about IV nutrient therapy? Is that a tool that we would deploy?
Yeah. Yes. Thank you very much. Absolutely. So in addition to our nutrient support orally, right, whenever we do IV nutrients, it's 100% absorbed. So if there's no worry if there's any gut compromise. I mean, as we know, leaky gut or gut issues are very common. And so, which makes the nutrients that you take less absorbed, right? So you have to take more. So if we do it IV, which I love doing, like a high dose IV vitamin C for an injury, it's fantastic. So all that vitamin C that you tried to force in, to your gastrointestinal system, we can just push it right in, and it doesn't cause loose stool. So you don't come in and get thousands. We'll do 10, 20, sometimes 40, 50,000 milligrams of vitamin C actually in an IV. And it feels fantastic. And the body just takes it and repairs wherever it needs to repair. So thank you. Yes, thank you for mentioning that. Vitamin C, we put minerals in it. We put B vitamins because those are all needed for cellular repair, right? So
combo that with, say, ozone injections.
Oh, absolutely. Yeah. So say if you're coming in and you're like, okay, I've had a significant injury in my joint, in my knee, but not enough to have surgery, but I want to push, I'm ready. I want to ski this, winter. I need to get back in the mountains. So I would put you on a protocol. Ideally, I'd probably have you do 8 IVs, 1 a week for 8 weeks. And then I would combo that we'd start with 2 prolozone injections into the knee. And then, of course, monitor how you're doing, from that point.
Well, how about when you're dealing with, say, an arthritis situation or maybe a bone spur type thing?
Great question. Yes. So, okay, we know, arthritis, long-term degenerative conditions. So we're digging in, we're still supporting the joints in this way. Absolutely. So all of these things still apply. It might be with the chronic degenerative arthritis that we were probably going a little further with our IVs, actually. We might, as opposed to an acute or repairing from a longer chronic injury. Arthritis, again, is chronic. It's progressive. I'd likely have you do the 8, and then we would reevaluate, and I'd probably have you do more at that point, and maybe even combo it with amino acids and additional minerals. Then we have to go a little further at that point. So we have to, when you've got arthritis, there's some underlying inflammatory stuff going on. So we've got to dive into your food allergies. We have to make sure that your body isn't dealing with other things that are causing inflammation. And so beyond food, that's going to be we get into viral checking, we get into metals, we get into, the gut, what is the gut doing, because it comes back to absorption, get into chemicals. So it really depends on the level of degeneration, and how fast it's progressing and what your age is and what your family history is like, what your history is like. But, if it's significant and we really want to slow this stuff down and we really want to push regeneration of that space, we've got to do some work around it. But the nice thing is, so I've worked on people where they're in their 60s. This is the first time they've really started addressing the pain in their knees. And when we've, done even the most basic of these things that we're talking about, it's okay, look, I can take the glucosamine and I can come in and have a few IVs, and I'm willing to take out my top food allergies and all right, I'll get a few injections in my knee. Maybe that's all I can do. And they've done fabulous. They've done really, really well. Their pain
little
has
goes
dropped.
a long way. So it's not like you have to do everything.
Yeah.
Just like so many other things in the regeneration space and the body space, all these things incrementally can help. Pretty significant improvements. Now, is it 100% gone at the end of this? That's hard to say, but
Can be.
Totally can be.
Yeah,
But
can be.
even if it's 70% better and you do 30% of the things that you can do and you see a 70% improvement, isn't that worth it?
It's absolutely worth
For
it.
most people, the answer is yes.
Absolutely worth it.
Very much worth it.
Yeah, yeah.
So then what about, you mentioned PRP, and PRP and then stem cells are two of the more potent tools in the regenerative kit. So why don't we talk a little bit about PRP and stem cell?
So PRP, platelet-rich plasma, is your own plasma. I know it sounds a little strange, but your blood is taken and your platelets are taken out and with your plasma and activated to put it back into any space in your body. So this therapy's been around for a long time. I mean, since the 80s, and now it's available at like University of Washington, at Swedish Hospital. Like, so there's a really amazing recognition of the power of PRP. So we offer it as well. And so I really love to like soup up the blood, like give people a couple of IV nutrients before we pull their blood. It's kind of like nourishing the blood to make it juicy, right? Make it really healed and juicy. And then, then we activate it. You activate it with calcium. We also use oxygen. I like comboing my PRP injections with ozone as well. And so we get a double whammy there of healing. So we got all that oxygen. We know that joints are really, if you think about it, like a tendon or a ligament, when you see it, it's like white because it barely has any blood flow, right? That's why it's whitish. And so it really is deficient in oxygen. And so I love comboing that oxygen with our PRP or stem cells, right? The amniotic, which you also are known as like Amniotic Biologics, technically. So yes, we would definitely start with PRP. Usually I do at least 2 of those, sometimes 3, especially if we're getting like a progressive, it's like every time I do it, it's better and better, which is what we would expect. If we do need a little more, some more severe joints, severe arthritis, severe injury, that's when we look at considering also like the amniotic cells, which are from like placentas from amniotic fluid. So no babies are harmed with those. Yeah. And can be amazing, especially if you think about like those young cells are being put into your body, and then what stem cells do is they go to areas of needed repair, and start secreting growth factors and start repairing specifically that tissue, which is pretty incredible.
So it's definitely a situation where, depending on what's going on, really, like so many of the things we talk about on the show and on, with patients, is it really comes down to creating a personalized approach and plan for you that really is dialed into your unique situation. And the main takeaway is that if you do have a knee injury or a knee issue, whether that's a long-term thing or short-term thing, there are very powerful options available for you that are non-surgical options that can absolutely help you speed up that healing and get to a spot where you're able to re-engage with the kind of activities that you really want to be doing. Don't settle for living your life accepting less than what you really want. So many people, when they go see maybe a traditional doctor, the traditional doctor will say something like, well, you need to stop doing XYZ thing. You just need to be done with it. Like stop skiing, stop running, stop whatever the thing is. Your body can't handle it anymore. Now, there might be times when that is a hard truth, but there's so many other times when we have all of these other intervention, all of these other therapies we can use that can potentially put you back into the thing that you love doing in a pain-free way that allows you to get a long, long, long time of enjoyment out of it. So explore that. It's worth exploring.
Absolutely worth it.
Do not accept less than what you really want. Explore these other therapies. So if this resonates with you, we're here for you. That's how the process goes. What we talked through today is exactly how we would approach this, with figuring out what's going on, then looking at getting the manual therapies in play, then looking at the nutritional supplements and looking at kind of the vitamin therapy, and then getting into some of these more regenerative therapies and interventions depending on your situation.
Yeah. Love to see you, and even if you're just unsure, a lot of these things are new to you, come in and let's talk about it. Let's talk about your situation.
Let's talk about it. And you kind of get a sense directly of what it would look like for you.
Exactly.
Awesome. Well, thank you guys so much for being here. And until next time, remember to elevate and thrive.
Bye.